My name is Edward Bloomfield. I'm a consultant clinical psychologist and also a trained union analyst, a psychoanalyst. I started quite young, actually. So I studied psychology in Italy when I was in my teens, and it always fascinated me. I've always been interested in the mind and what makes us the way we are. Why I became a clinical psychologist and then an analyst is I think it's something that we all we need to varying degrees, but everyone needs a space where they can talk to somebody about things that they're struggling with. I mean, all of us struggle from time to time with different aspects of life and just the experience of being human. And life can sometimes be confusing, life can sometimes be distressing. And just having that space to explore, be heard, to make sense of our life experiences or current difficulties, that's such an important thing. That's what drew me to wanting to become a psychologist and a therapist. It may sound like a cliche, but it's actually a privilege to be able to talk to people about things that maybe they haven't spoken to anyone about. It's also rewarding when you feel you can make a difference, and that might be that you're able to help somebody with certain things that they're struggling with, to make sense of it, and perhaps to find another way of tackling things that have been difficult for them. And it's not necessarily that as a therapist, we have a different way of, we have the solutions, as it were. It's that more often than not, you can help the person find something within themselves that provides an answer or a way forward, but that can often only come out if the person's given the space to think it through with somebody else and talk it through. But the thing is, entering into a conversation at a deeper level with somebody and helping them feel unburdened or feel understood, feel that they got a better understanding of themselves, or perhaps that they can relate to themselves in a way that's more understanding, more compassionate. Seeing that happen has its own rewards. So that, I would say, that's one of the most rewarding things. I think it's when they feel that I can meet them on a human level. I'm often thinking quite closely to what it is that they're saying, why they're saying it, what might it mean. But I'm also quite transparent in sharing with them what my thinking is about how I've heard what they've said, how I make sense of it. I'm also quite receptive to when somebody says, I don't think you've understood that, or you've misunderstood this, or there's another aspect to this that you haven't understood, or sometimes actually even being able to share with me how they feel when they feel misunderstood. So I think it's that process of feeling that I'm attending closely and carefully to what they're saying and feeding back how I understand that, and that's a process of a dialogue that's open and reciprocal. When I say reciprocal, I mean not that I share with them necessarily what about myself, but I will share how I understand what's happening between us, how I understand their difficulties, how I understand their communication, and that understanding gets mutually elaborated, that we're thinking together about how we refine that understanding. So it's a two-way process in that respect, that's ultimately going to be helpful for the patient, both in terms of feeling understood, but also to help them get an understanding that's going to help them move forward.